Hello and welcome to the second part of the oral placement therapy series, where today we are going to talk about Honeybear cup, horn kit and straw kit. We're going to start with Honeybear cup because it is the first tool to use. It is the easiest one, which allows tongue retraction, that is, allowing the tongue to move towards the back of the mouth so that things like spoon, straw or a normal biting can be performed by the person. It reduces forward tongue thrust, so if there is a tendency for the tongue to come forward, not allowing biting or introduction of food in the mouth, spoon, straw, anything in the mouth, it's going to help you there, even toothbrushes. The benefit of Honeybear cup is being the basic one that it is supposed to be squeezed, so liquid comes out of the top and there is no need to suck onto the straw and then try to take the liquid inside. So as a first step, it is beneficial. Then we can move on to straws. Now, because the straw has a specific function that it helps in dissociating the functions of jaw, lips and tongue. Simultaneously, it also helps in retraction of the tongue also, which we had begun with Honeybear cup. The rounding of the lips around the straw for ease of drinking, and the fourth very important function of abdominal grading. The straws are graded. There are 8 straws that are available. Straw number 1 to 4 are of large diameter, so it can be practiced with nectar thick liquids. 5 to 8 straws have a smaller diameter. They have increased thickness of the liquids that can be used, that is more viscous liquids, so one sip at a time can be practiced initially. The principle here is you only progress to the next straw when you have mastered the previous one. And mastering the previous one, the criteria is, while drinking from the straw, there is first no leakage, the jaw is stable, lips are slightly protruded, that is rounding around the straw, and 4 ounces of liquid is taken in 2 minutes or less. And then the next straw can be progressed to. We can come next to horn and whistles kit. Now there are 12 types available in this for horns and whistles. Of course, we know the function of it is blowing. So an excellent exercise for abdominal grading so that the child or even an adult is able to make longer sentences, because trust me, speaking requires the function of exhalation, that is breathing out for longer duration if you want to talk continuously. 12 types of horns and whistles are available. The rounding and closure of the lips around the horns and whistles helps in speech clarity also. And speech clarity includes making very clear speech sounds. There should be a good coordination between the oral and the nasal cavities so that there is appropriate closure at the right time so that the voice is not too nasal. And we can see that the nasal cavity does need to close down when we are swallowing. Otherwise, we could have a regurgitation or a nasal, basically regurgitation of food or liquids. So in order to avoid that, horns and whistles are a really helpful technique. And they also help in controlling some kind of tongue thrust because you're introducing something around the lips till the teeth, and of course drooling function as well because they help in lip closure. Then there are a few situations in which things like horns, whistles need to be avoided. If there is teeth biting on the mouthpiece, so stop it for that time and you can reintroduce it. Children who might have, or even adults who might have excessive tone in the body gets tight in an extended position. Among the 12 types of horns and whistles that we have just shown, 9 to 12 are very hard. They require a longer duration to blow them. Abdominal grading is much higher. A lot of tongue retraction is required for them, and hence they should be kept as a last option. Hope this was an informative video for you. Let me know in the comments below and any other video suggestions that you might have. Please keep watching this series of oral placement therapy so that you can learn about other components of it as well. We'll meet again soon. Bye.